Hello nurses, how are you all? Welcome back to my channel Nurse Navigator Swati. I am back with the third part of Medical Surgical Nursing MCQ question and answers. Quickly go through my part 1 and 2, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1, how will you diagnose aplastic anemia? Options are blood smear, bone marrow biopsy, spleen biopsy or option 4 complete blood count. Aplastic anemia can confirmedly diagnosed by bone marrow biopsy. So option 2 is the right answer. Next question. What is the best graft for CABG? Options are reverse saphenous vein, left radial artery, left internal mammary artery or none of the above. The best graft for CABG is left internal mammary artery. Question number 3. The nurse helps the client with chronic renal failure develop a home diet plan with the goal of helping the client to maintain adequate nutrition intake. Which of the following diet would be most appropriate for a client with chronic renal failure? Options are high carbohydrate, high protein. Option 2, high calcium, high potassium, high protein. Or option 3, low protein, low sodium, low potassium. Or option 4, low protein, high potassium. For a chronic renal failure patient, the most appropriate diet should be low protein, low sodium and low potassium. So option 3 is the right answer. Question number 4, the earliest sign of increased ICP the nurse should assess for. Options are Cushing triad, unexpected vomiting, decreasing level of consciousness or option 4 dilated pupil with sluggish response to light. The earliest sign of increased ICP is decreasing level of consciousness or LOC. Option 3 is the right answer. Question number 5. What should be added to normal saline which is connected to arterial line measuring invasive blood pressure? Options are calcium, potassium, protamine or option 4 heparin. Yes, you are absolutely right. Heparin is added to normal saline which is connected with the arterial line measuring invasive blood pressure. Option 4 is the right answer. Question number 6. During dressing change, inspection of the wound reveals what appears to be reddish pink tissue in the wound. The nurse interpret this is options are exudate, granulation tissue, eschar or a sign of infection. Yes, you are right. Appearance of the reddish pink tissue in a wound, it is a very good sign. Its granulation tissue is formed. So option 2, granulation tissue is the right answer. Okay, next question. A 40-year-old unconscious patient is brought to the casualty following road traffic crash. His blood pressure was 80 by 60 mm of Hg. What will you do first? Options are protect airway, start vasopressor, CT scan of head or option 4 infuse 2 liter of crystalloids. Yes, in this case your first action will be protect airway. Option 1 is the right answer. Other all the options you will do but that will not be your first action. Question number 8. Which of the following is considered the fifth vital sign in emergency department? Options are motor response, response to pain, verbal response or option 4 pupillary reaction to light. Yes, you are absolutely right. For an emergency department, for emergency patient, the fifth vital sign is pupillary reaction to light. Next question. You are giving dextrose 50% to a patient IV. All are complications except. Options are edema, renal failure, hyperglycemia or thrombophlebitis. Yes, for giving dextrose 50% in IV, it will not develop any complication of renal failure. Option 2, renal failure is the right answer. Question number 10. Which is the long-acting insulin? Options are Glargine, NPH, regular or Lispro. Yes, absolutely right. Option 1, Glargine is the long-acting insulin. Question number 11. The drug used to prevent aspiration and decrease the secretion is, options are atropine, adrenaline, noradrenaline or dopamine. Yes, atropine is the drug which is used to prevent aspiration and decrease the secretion. So option 1 is the right answer. Question number 12. How a nurse assesses the proper functioning of laryngeal nerve after thyroidectomy? Options are provide oral fluids, throat swab for gag reflex, tell to speak words or option 4 check motor responses. Yes, for assessment of proper functioning of laryngeal nerve after thyroidectomy, the nurse will ask the patient to speak words. So option 3 is the right answer. Question number 13. In chest tube drainage system, there is a fluctuation in water cell chamber with respiratory efforts. Nurse finds it as, options are kinking of chest tube, normal process, it's a air leaking or option 4 none of the above. Yes, fluctuation in water cell chamber with respiratory effort is a very much normal process. So option 2 is the right answer. Next question. There is no oscillation seen in chest tube drainage system inserted for pneumothorax. The nurse understands that the tube is blocked, it's a normal process, its air is leaking, or option 4, none of the above. Yes, if there is no oscillation in the chest tube drainage, that means tube is blocked. So option 1 is the correct answer. Question number 15. A patient is admitted in ward with prior MI attack. He complains for chest pain. First action of nurse is, options are provide nitroglycerin sublingually, set an ECG done, order for trop-T, or order for an echo. Yes, patient is having a prior MI attack. So first action of a nurse in this situation will be provide nitroglycerin sublingually. So option 1 is the right answer. Okay, next question. Best method to check fluid replacement in adult is, options are blood pressure, respiration, pulse pressure, or urine output. Yes, obviously the best method to check fluid replacement in adult is checking the urine output. So option 4 is the correct answer. Question number 16. All are the risk factors of cardiac diseases except, options are office job, age above 70 years, increased HDL level, or option 4, increased LDL level. Yes, absolutely right. Increased HDL level is not an risk factors for cardiac disease. So option 3 is the correct answer. Other all the options are risk factors for developing cardiac diseases. Next question. While a patient with ascites is receiving albumin, the planned therapeutic effect will be greater if the nurse regulate the infusion to flow slowly and restrict fluid intake, rapidly and withholds fluid intake, rapidly and encourages fluid intake, and option 4, slowly and encourages liberal fluid intake. Yes, patient is developing ascites and also receiving albumin, so the rate should be slowly and also restriction of the fluid intake. So option 1 is the right answer. We will not encourage liberal fluid intake, or we will not infuse rapidly. Question number 19. Increase in number of cells are called metaplasia, dysplasia, hypoplasia, or option 4, hyperplasia. Yes, you are absolutely right. Hyperplasia is the increase in number of cells. So option 4 is the correct answer. In this session, the last question is, hemothorax occurs in, options are thoracic cavity, pleural space, peritoneal space, or periosteum. Yes, the hemothorax is collection of blood in the pleural space. So option 2 is the correct answer. Let me know how much you have scored from this video, and also mention me in the comment the topic on which you want more MCQs and explanation. See you soon in my next nursing quiz session.